Hello guys, you are welcome to my YouTube channel. My name is Dr. Ipeleng and I make videos about women's health. Today I decided to discuss something very common that we probably all know, vaginal yeast infection, which is also known as vaginal candidiasis or vulvovaginal candidiasis. This is not a sexually transmitted disease. It is actually a type of fungal infection. Under normal circumstances, your body contains a type of fungus called Candida. And if it's in balance with your body, there is no issue. The moment there's an overgrowth of this type of yeast, you are at a higher risk of developing a vaginal yeast infection. Vaginal yeast infection is a type of vaginitis. This is a condition where your vagina is swollen, painful, and possibly infected. There are several types of vaginitis, and all of them actually have similar symptoms. It's actually strange to think about it, but you do actually have fungus living in your mouth, in your digestive tract, and in your vagina. And it's supposed to be there. Under normal circumstances, it does not cause any problems. The good bacteria in your body helps to keep it in check. There are some factors that will affect the growth of the good bacteria, or even the amount of the good bacteria that you have in your body, which then leads to the overgrowth of the yeast known as Candida and yeast infection consequently. Let's discuss the symptoms of vaginal yeast infection in detail. The symptoms actually mimic a sexually transmitted infection, which is why you need to contact your healthcare provider just to be sure. The way that your vulva looks and the way that it feels, and even the discharge that comes out of it, changes when you have vaginal yeast infection. You will have the burning sensation when you pee, and even when you are not peeing, you will have some itching and some pain around your vulva. The itching and the burning will not only get worse when you pee, but also when you have sex. You may also notice some tiny cracks and some cuts because the skin becomes very fragile. Apart from the burning sensations and the cracks, the redness and the swelling of the vulva, and also the discharge that changes, becomes thicker and lumpier, looks like cottage cheese, especially with the consistency. It is not supposed to smell. If it smells any kind of way, you might worry that it's something different other than yeast infection. Not everyone with yeast infection experiences symptoms, and not everyone will have the same symptoms. Who does it affect? Basically, anyone with a vagina, people who were assigned female at birth, and it's very common after puberty and just before menopause. Certain factors can also put you at a higher risk of developing yeast infections. They are very common and highly treatable. Talking of common, how common are they? About 75% of women or people assigned female at birth will have one yeast infection, at least one yeast infection in their lifetime. And over 50% of women will have two or more infections in their lifetime. Remember, I mentioned vaginitis. Vaginal yeast infections are the second most common type of vaginitis, the most common being bacterial vaginosis. Risk factors: the use of antibiotics. Anytime you use antibiotics to treat certain infections, not only do you kill the good bacteria, the bad bacteria, I mean, but also the good bacteria. And when you do this, there's a shift in the balance. When they say shift in the balance of the good bacteria, you are at a higher risk of developing yeast infections. Also, the use of steroids or the use of birth control pills. Another risk factor is some diseases or issues that will lower your immunity. This include HIV or AIDS, and they also include the chemotherapy and the radiotherapy that is used to treat certain cancers. It lowers your immunity and puts you at a higher risk of developing yeast infections. Unmanaged diabetes, this is a common one. When you have unmanaged diabetes, your blood sugar is very high, not only in your blood, but also in your pee. leading to increased risk of having candida or yeast infections. Pregnancy and hormones. Anything that affects the hormones in your body, really, pregnancy, use of birth control pills, and even changes during your menstrual cycle, anything that affects the levels of hormones in your body will affect the amount of candida or the balance of candida in your vagina, leading to increased risk of yeast infections. Certain lifestyle factors can also put you at a higher risk, such as not changing your sweaty clothes, sitting in a wet bathing suit, using scented tampons, or even vaginal deodorants. The diagnosis. Your healthcare provider may want to take a sample to confirm at the lab the diagnosis of yeast infection, but most of the time it's just enough to really look at the symptoms and even the type of the discharge that you have to know that this is a yeast infection. When we talk about the treatment, your healthcare provider will decide what kind of treatment to give you based on the severity of your symptoms and even the type of yeast that you have. There's a lot of antifungal medications, and most of them are effective in the treatment of vaginal yeast infection. You can get the oral medications, the most common being the fluconazole, which you get just one dose and once, or you can get the topical medications, topical creams, or the suppositories that you will use for a minimum of 7 days in order to clear the yeast infection. It is important to follow the instructions of your healthcare provider so that the candida is cleared or the infection is cleared, and it doesn't come back, just after a few days of taking the treatment. One important thing that I have to mention, if you are taking treatment for yeast infection, it is recommended that you do not have sex until you have completed taking your antifungal medications so that they are effective in the treatment of your infection. This is because sex can cause more irritation, and some of the antifungal medications can weaken some of the materials that are used in condoms, in diaphragms. So, what about the use of over the counter medications? You can use over the counter medications, but if you are not sure that what you have is yeast infection, you might want to contact your healthcare provider, who will make sure that this is a yeast infection and this is the right kind of treatment for you to use. How long is the infection supposed to last, or how long does the infection last? Most of the infections will clear up within a few days. That is, if you are using the treatment. If you're on treatment, they will clear up within a few days, up to a week. Some may even take longer, and you may need to use treatment for a longer period, longer than a week. Just make sure that you take the medications as directed, because if you stop too soon, the infection might come back. If you're wondering if the yeast infection will go away on its own, it very seldom goes away on its own. So you need treatment in order for the yeast infection to clear. How do you prevent vaginal yeast infections? There's a few things that you can do. Not douching. Douching can destroy the good bacteria that keeps the fungus in check. So when you douche, you're destroying the good bacteria, and you can end up having vaginal yeast infection. Another one is making sure that you change out of the wet clothes. If you went swimming, change out of your wet bathing suit right away. If you are sweating, change out of your sweaty clothes right away. And wearing cotton underwear. If you can get cotton underwear, those are very good and those are recommended. So put on some cotton underwear instead of synthetics. And if you have diabetes, make sure that your blood sugar levels are under control. And if you have other illnesses such as HIV or AIDS, make sure that you take your medications on time and that you are virally suppressed, so that you are not at a higher risk of getting the vaginal yeast infections. Also, wearing loose fitting clothes, not using vaginal deodorants or scented tampons or even scented pads. Avoid using those. There are some people who have like frequent yeast infections. If you're having frequent yeast infections, you may want to test or talk to a healthcare provider to make some tests to confirm that it is indeed yeast infection, and test for HIV so that you are started on treatment as soon as possible. Test for diabetes again so that you are started on treatment and you are able to control your blood sugar, because now you know where the issue is or what the issue is. Discuss any changes in your hormones, be it pregnancy or birth control. So discuss that with your healthcare provider if you are on any birth control, hormonal birth control, so that you can change it to something much more suitable for you. So if you like this video, go ahead and comment or even ask questions down in the comment section, and I'm more than happy to answer your questions. Like, share the video, and see you in the next one.